You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Dr. Lloyd Humphreys, who's the managing director for Orca. Welcome to the show.
Thank you very much for having me, Roxy.
Dr. Lloyd Humphreys, no doubt.
Sorry? Yes, absolutely.
So let's start off the episode by just telling our audience a little bit about your background and what you've been innovating these days.
Yeah, so as you said, I'm the managing director here at Orca, so I am helping to lead the organization with the founders. But by background, I'm actually a clinical psychologist by training. I worked in the National Health Service here in the UK, working with complex trauma. Left the NHS because I felt that things could be done in a more innovative way. So I then set up my own clinical psychology services with another psychologist, took that to scale, and then realized that the number of people we could help was always going to be correlated to the number of people we could hire. So we turned to technology as a real great multiplier effect. And so right in the early days, I think this was around the time of the iPhone being launched. So this is how long ago it is, and I'm showing my age. I co-created one of the first online treatment programs for addiction, took it to scale, sold it on. And then since then, I've helped other technology companies to scale their solutions. It's been fantastic to join Orca and the founders on this journey.
So before we dig into Orca, just kind of looking back on all of the commercialization businesses that you've been a part of in healthcare, what are some of the things that you've seen, lessons that you've learned of things to do or things to not do?
Yeah, I think for me, I've been saying this quite a few times today. I think for digital technologies, it changes so fast. And sometimes you have to kind of react to those market changes, but sometimes you have to kind of stay the course. So for me, it's about always kind of creating core repeatable business with your technologies, rather than reinventing a technology to fit kind of the whim of the moment, because we see healthcare go through these constant kind of evolution cycles. And that can kind of kill a company reacting, because when you do react, you're always behind that reaction. So for us, it's about being able to work and predict the market and guide the market and create it as well as react to it. So I think that's kind of one of the key lessons here. And secondly, have the best commercial model you can. I can see really great ideas and they kind of die on the commercial floor because they haven't got the kind of right commercial model. So it's really important that those two things are kind of established.
Yeah, my heart goes out to some of these innovators that I've seen where they literally have their technology app built. You can go to the App Store today and download it, and they still don't know exactly what their business model is. Woo.
Yeah, and the problem with this is that often what happens, particularly in digital health, you have someone with a clinical background and they've got a really great idea to solve a particular pain point, but they don't understand the technology side of the equation. And so they kind of stumble at that, or you get a technologist that says, hey, this is kind of a great idea from a technical perspective, but then don't understand how it's going to be kind of used in practical kind of real terms and how it's going to help that person on the ground, in terms of seeing patients or helping people. And so it's the magic really happens when you bring those two types of people together.
Yeah. I was talking to someone earlier today and they were saying that you've got to find someone that's going to eat the dog food.
That's a really nice phrase.
And so, who's going to buy it? Who's going to eat the dog food?
Yeah, absolutely. And if we're eting dog food, can we please make it taste nice? That's
right,
not the great picture that I've got in my head right now. So.
Exactly. So let's dig into Orca a little bit. So what is Orca? And, what's the mission and purpose behind what you guys are doing?
Yeah, well, the reason that we exist is when we look to digital health, we kind of know that there's about 365,000 technologies on the market. But only 20% of those technologies reach any sort of baseline criteria for quality. So 80% of technologies out there right at the minute are at best ineffective and at worst dangerous. So how are we expecting healthcare professionals to know which ones to use, which ones to buy, which ones to commission? How are we expecting organizations to know which ones to reimburse? Or patients, which ones they're expecting to use and benefit them? And so there's this whole kind of risk associated with digital health right now. And this whole wild west, when we consider there's nearly 250 new technologies coming onto market every single day, means whilst we're talking, at least 10 new products will be kind of coming to market somewhere in the world.
Yep.
How do we kind of help, in terms of making safe decisions? In every other part of kind of healthcare, we have lots of infrastructure to help with making safe decisions. When we look to medicines, we have like the FDA to approve and license drugs. We have organizations like ICER to look at the effectiveness and impact. We have the Orange Book to know when to prescribe and when not to. And we have wonderful e-prescribing platforms. So you get kind of your prescription delivered to your door. None of this exists with digital health. And so this is kind of why Orca exists, is we are the global leader in terms of assessment of high quality digital health products, and also in terms of assessment, accreditation, and distribution as well. So we assess and accredit technologies, and we also help distribute them through digital formularies.
So how is this different than, say, anything like you named some of those quality organizations, let's say like NCQA or even URAC, just for folks in our audience, what would be the differences between what you're doing and what are those quality initiatives already doing in the marketplace?
Yeah, there's lots of wonderful kind of organizations like the ones you've mentioned, actually, that are really doing, and what they do is they focus on things like software as a medical devices and things like that. And the FDA is doing this, and we can see this with 510Ks, the Breakthrough Devices Program, prescription digital therapeutics. And that's absolutely kind of wonderful and absolutely kind of needed. But when we look to the market, medical devices and software as a medical device accounts for just 5 to 10% of those technologies. What about the other 80, 90, 95%? There's no one out there helping to really kind of define what good looks like with those. And whilst digital therapeutics are absolutely kind of essential, not everyone needs a digital therapeutic. Sometimes we need information, signposting, guidance, support. Sometimes we need that kind of network, medication support, things like that. So for me, we need to be able to cover the entire market if we're really going to truly embrace digital health. We shouldn't just be kind of specializing in one area. And that's kind of where Orca comes in.
So part of what has been done historically with those innovators is really doing either some type of clinical trial or some type of piloting program with their target customers. And so they're trying to build that evidence, build that clinical evidence that establishes that it's safe and that it's effective through pilots. So is this something that replaces piloting, or is this something that augments it? How do those work together?
So what we've done, we've tried to, we've worked with 12 countries right across the world, in 12 countries, we've helped kind of design, assess, or accredit schemes. So for example, we've worked in New Zealand to kind of help with Health Navigator to define what digital health looks like there. Israel, the Netherlands, the Nordic nations with the Nordic Baseline Review, and the UK. So Orca helped assess products for the NHS Apps Library, for example. So it's not a replacement for those, but it's the ability for those technologies to kind of say, yes, we reach the quality criteria along a number of different dimensions. And absolutely, clinical evidence is one, but it's not always necessarily going to be appropriate for every type of technology. Again, thinking about an administrative tool, I don't know, a patient booking system. You don't necessarily need clinical evidence in terms of the effectiveness of a patient booking system. You need to know that it's efficient. So how do you kind of prove that? You don't need a randomized controlled trial necessarily, or for an information or support website. You just need content verification. So it's about making sure, and we assess across 4 ostensible buckets. So firstly, data and security. Data and privacy. So making sure that it conforms to things like kind of HIPAA here in Europe, GDPR, etc. What's its security? So is it kind of high tech? Does it kind of form to NIST? Here it's kind of cyber essentials, etc. And then we look at accessibility. Does it kind of fulfill people in terms of those with impairments? What's the user experience like? And then last, is that clinical evidence or professional guidance? Yeah, was it created by someone who has a professional kind of qualification in that area? Does it have randomized controlled trials? And each of those four areas, you do need to kind of have a proportional approach to the assessment based on the type of technology that it has and the intended use of that technology.
Yeah. Just kind of pausing, there's so much to unpack in what you just said, but one that really strikes me is just the user experience. I think way back when 10, 12 years ago, we had, everybody was launching patient portals, provider portals, and there was this kind of sense of patients and providers don't want portals. And it's kind of been kind of like stigmatized. And what we've seen is that the reality is that most of those weren't effective, they weren't useful, or they just had really clunky user experiences. So it wasn't that the patients or the providers didn't want those tools. They just needed a higher quality tool in order for it to actually be useful for them. And it sounds like part of what you'll be doing is helping to elevate that.
Yeah, well, figure out the problem you're trying to solve. And was that the problem, or were they looking at the solution first? So ask the right question before you get to the answer. Sometimes we start with the answer because we assume what the question is. And so often that's the case. Or we're trying to solve a problem that doesn't exist. So it's really important that you unpack, why you're doing what you're doing in that way. And we do know, we just run a survey here, and we do know that patients absolutely embrace digital health. In fact, 67% of people in the UK believe that digital health will help alleviate the pressure on the healthcare system. And over half, not half, just up to half of people have actually used a digital health app in the last year. And 83% of them found it helped their health. So people want it, people embrace it, and people use it, and it benefits them. So it's about making sure that we provide the right solutions at the right time.
So who are your customers?
So we work with developers to help them to demonstrate the high quality solutions that they've developed. So developers like to work with us because they want to show the differentiation. They want to show that, they have got a high quality solution. We work with governments and organizations to help them define what good looks like for them. And so we help them develop digital health assessment frameworks. And we've done that in the US, working with the American Telemedicine Association, the American College of Physicians, to create the US Digital Health Assessment Framework. That's been launched. That was launched a couple of months ago. And now that's getting a large number of developers through that framework because they want to demonstrate the quality of their solutions. So working with organizations to do that. And then we work with both payers and providers to help kind of distribute those high quality innovations. So being able to provide digital formularies so that healthcare professionals can recommend directly to patients, but also app libraries where patients can self-serve, find those over-the-counter technologies that can help them with their day-to-day health as well.
So where are we with the maturity of the market? Do you find, and it may vary from different customer segment as you just described, are we kind of like in a pre-awareness stage to where we're having to persuade some customer segments that quality is a problem? It's kind of the wild, wild west with digital health. And so that we need to establish those standards, or are we working with maybe a little bit more maturity where people are actually seeking out these frameworks and these methodologies that you're bringing to market because they've been stung by either the danger or the ineffectiveness of some of these tools out there?
It's quite an interesting question. I think different countries around the world are at different stages of recognition. I think it's only recently that we've started to recognize that there might be some risk associated with digital health. The opportunity is clear, and COVID has brought that into stark focus in the fact that actually traditional care, wasn't able to be delivered. We had to turn to digital health to maintain some level of healthcare delivery. So digital health, the opportunity is there and it's here to stay. But what we haven't really focused on is not just the opportunity, but the risk that comes with that. We wouldn't kind of expect, a nurse to prescribe a drug to someone just because they might have tried it last week and it helped them. And yet there's people all over waving their phones going, hey, I tried this great app last week. Why don't you give it a go?
Yeah.
If that happens, who carries the liability if something goes wrong?
Yeah.
Is it the person who recommended it? Is it the organization that they work for? Or is it the patient that's actually kind of taken that advice? We haven't even considered the liability issues around digital health. We haven't considered the risk that actually what happens if we get it wrong. And so these are the things that are coming into stark focus. Some digital formularies now are building their digital formularies, and they're building them based on kind of commercial relationships, rather than actually kind of quality of solution, or maybe in terms of volume or market share, rather than actually in terms of kind of clinical output. And so for me, we need to kind of have a look at, if we're going to have a look at the opportunity, we need to kind of look at the other side of the fence as well, and to make sure that we can support great technologies, and help them accelerate, but also provide the choice, the breadth and depth of solutions, so that we don't kind of take a one size fits all to digital health, that we can actually kind of serve the entire kind of healthcare community.
Mm-hmm. So do you see Orca maybe, I don't want to put words in your mouth, but is it maybe a pathway for accelerated commercialization for innovators because they have been validated? Maybe faster. One of the things that I hear all the time when we're working with startups is just the piloting process. And, so they're already, struggling with funding or, right. Some of them bootstrapped, some of them funded, and just trying to make it these couple of years. And then they get stuck in these piloting engagements that take 2-3 years to kind of complete and gather that evidence. Is this potentially a pathway to be able to establish that high quality measure or benchmark much sooner and helping them with the commercialization?
We're never going to be a replacement for all of those things. What we do is we shine a light on great kind of technologies. We consider ourselves to be an enabler. We consider ourselves to kind of support the market on every side of the fence in that way. So it's shining a torch. So it's not a replacement for generating that evidence, getting great customers, having those pilots. But what we do is we kind of, light that up so that others can see that. And so they don't have to say, right, well, we've done it over here and we need to repeat it over here, just because there's lack of awareness. So we kind of, we helped kind of enable that, enable everyone to kind of come together, so we're the place where people can find, demonstrate, and then distribute those great technologies. And that's really kind of important, and a number of countries are trying to do this in some way. So often, Germany is kind of brought up as a good example. They've got something called the DIGA, where they've got a great digital framework. They've got central reimbursement. But there's two problems with that. They've got funding, central reimbursement. They've got a framework to show what good looks like, but they've only been able to assess just 33 products in 2 years. Now, if we think about that as a digital pharmacy, the cupboards are bare, and only 7 of those have got final listing. And so we need to kind of be able to accelerate. That's not accelerating that market. That's going at a glacial pace. To put this in comparison, we've done over 18,000 assessments on 7,000 products. And we do about 400 to 600 assessments per month on products. And so it's kind of, we need to be able to kind of move at that pace. And unfortunately, sometimes, agencies kind of tend to kind of move at that slower pace. We as an independent organization can move at that sort of acceleration because we're a technology driven company. So that's kind of where we would consider ourselves an accelerant to the market, but more crucially, an enabler to kind of reduce risk, improve quality, and improve adoption.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. I can see that on the, the B2B side as well, because they are, the amount of time that it takes them to sort through all the digital health options that are available in the marketplace, and to be able to identify them, to be able to assess which ones are the higher quality, and then the risk of, one CIO making that decision and kind of, and sometimes putting their whole entire career on the line for whatever that they've recommended for to be invested, without having that third party to help with that validation process.
Yeah,
I can imagine that might go faster.
Yeah, it takes years. And what usually happens because of that, because it takes so long to do that, you have to go through that assessment process. You have to look at all of the things from financial and commercial viability to quality and, make sure all those regulations. And that takes a long time. So usually what happens, because it's such a labor intensive process, a lot of payers or providers, they'll go, right, okay, well, what's the best one for depression? What's the best digital health? Because they haven't got time to assess multiple ones. And so they go, right, what's the best one for depression? And they shortlist it down, and then they go through that big long cycle, and they come out with the other end and they go, hey, this is the best digital health solution for depression for us. But that kind of flies in the face of how we deliver healthcare in every other walk of life. We don't just have one antidepressant medication. We have a whole sea of them, and we prescribe that medication based on the person presenting their problems, their history, and we personalize that medication to them. But we're not doing that with digital health because of that inefficiencies in the system. And so we usually have a one size fits all, and we expect everyone to respond to that one digital health solution in exactly the same way and positively. And then we kind of sit back and think, well, why isn't everyone benefiting from this? I don't get it. And it's because, we're expecting too much.
So it sounds like what you're saying then is that you envision that there could be multiple high quality depression apps, using that same example. And some people might have success with some, and some people might have success with others. And that doesn't mean that the quality of both is not there. It just means that people are different, just like you're describing with the way we engage with medication
or any other part of healthcare. We're going to respond in different, like in all parts of our lives. We all kind of have choice, and we all respond in different ways. We all learn in different ways. We all kind of face treatment in different ways. And so we need to be able to personalize that. And you're only going to be able to do that if you have the breadth and depth of solutions available to you. We need to kind of take that sort of medication or other healthcare treatment paradigm and apply it to digital health. And we haven't been doing that. And for me, it kind of, it's kind of really confusing that we haven't taken that approach. And it's because we don't have that infrastructure in place to do so. And that's kind of what Orca does. We provide that infrastructure to enable that breadth and depth and choice available. So you can personalize those digital health. And it's strange that when we have digital that can have AI and machine learning and personalize in so many different ways, that we're not kind of taking that at the front end in terms of personalizing and having that choice of solutions.
Well, I think part of it is just this fundamental shift too. It's just how we imagine this healthcare, that, still, I think there's so many organizations that speak to all patients the same, or all oncology patients one way, and then all MS patients another way, but still realizing that all oncology patients aren't the same just because they share this disease, or all MS patients aren't the same. So going even further on the digital health, thinking about messaging, thinking about, education, and being able to personalize it at scale is really something I think we still have a lot of opportunity to grow into.
There's so much opportunity and so much kind of ways that we can benefit the healthcare system. I envisage the day when we talk about digital health, but we drop the word digital. It's just health. It's just another modality of delivering care. And that's kind of where we need to get to. But we're so far off that because we're not learning the lessons from other parts of health. And we need to kind of apply that, and we need to accelerate it, and not kind of be fooled in some of the senses of the glitz and glamour that we've got to have one choice and there's a best kind of app, and because we're often asked, what's the best app that you come across, Orca? Doesn't exist, there isn't, like there isn't just one best drug,
Yeah. I think of the health, I think of the payer formulary as being a great example of that, of kind of having a framework that patients go through, but they try different tiers before they move through that formulary and get to whatever the solution that's going to be right for them.
Yeah. But in that formulary, you've got a breadth and depth, again, to come back to that phrase, of solutions. So you can go through that formulary. If they don't respond to this one, then you've got a choice available to you. If you look at existing formularies that are on the market, they've got about 20, 25 solutions in there, which means, and usually 2 maybe for mental health, or maybe 3 for behavioral change. You suddenly get to the bottom of the list pretty quickly. So, so we need to be able to kind of expand, and we need to be able to drive the efficiencies. And that's where assessments, the ability to kind of have quality digital health marks and things like that are absolutely kind of fundamental.
So in some of our conversations before, you had mentioned that the way we're looking at care, digital health, as being just an offshoot of traditional healthcare. Describe why that's a problem and what we need to be doing going forward.
Well, one of the problems with digital right now is we're seeing it almost as a separate, parallel digital pathway, that we're kind of seeing it as almost a diversionary tactic, that we've got traditional care and then we've got digital, and we can push a certain number of patients over to this separate pathway over here. And that doesn't work for me, because, that patient's going to come around the loop at some point. And so for me, it's about making sure that our pathways that we have are technology enabled, that we embed digital into our existing pathways, not see it as a separate, parallel, diversionary pathway where we can push patients to, for some efficiency gains. We need to kind of have a technology enabled. This is why we've been creating toolkits across certain pathways. Toolkits of technologies, a short number, about 12 to 15 apps or technologies within a particular chosen pathway. For example, in elective care for, say, MSK or ophthalmology or dermatology, and you have a certain number at each stage of the pathway that enables it and empowers it. And that might be from waiting well on a waiting list. It might be some pre-op assessment technologies, some for rehabilitation and post-care discharge. And so being able to kind of embed those technologies, not one that goes across the whole pathway, but chosen technologies with choice at each stage, that really kind of then accelerates that pathway and really turbocharges it. So we need to kind of think about it in that way rather than this parallel diversionary approach.
So how are we going to get there? What needs to happen?
Well, we need to support it. And this is kind of why, I'm really kind of passionate about what Orca does. We need to get there, by being able to support each part of the journey. Firstly, by identifying great technologies that are in existence and supporting those that are coming through, being able to then shine a light and have those assessment frameworks where people can demonstrate those products. And then we need to be able to kind of get them into the market and then look at those reimbursement approaches, looking at the different ways and creative ways. We don't just need to kind of have a CPT code or other. We need to kind of have a look at other ways that we can kind of fund that. And obviously kind of reimbursement codes are kind of fundamental, but are there other novel ways that we can kind of then, digital health has so many wonderful kind of commercial models, in terms of look at the iPhone, the different ways that you can kind of pay for apps or not pay for them, etc. So I think there's lessons that we can learn from other industries that we can apply to that. So firstly, identify, assess, accredit, then kind of be able to distribute, and then be able to kind of look at the outcomes. And therefore, if we can have a look at that, then we can start to then be able to look at things like population analytics. We can start to look at preventative. So one of the things that we have a look at in our formulas, we're able to look at what people are searching for. We're able to geolocate, so we can have a look at underserved populations. We can see areas of kind of really high growth or high need. We can see whether people are searching for particular technologies, so that we can identify this ahead of schedule. So when you start to power the whole system, it kind of then reinforces itself, and that's where we're going to get the acceleration.
Hmm. So Lloyd, I think you've got such a unique perspective of being, a global company and having already commercialized your solution in various forms across different countries. Kind of give our audience a little pulse of what are some observations of maybe where we are in different markets, in a way that might be beneficial to people that are determining whether I enter into the US market versus Asia, just kind of getting a pulse of where we are, market by market from a digital health standpoint.
I mean, we kind of categorize markets in different ways. I mean, we have a look at those that are ready for acceleration, that have got a really great foundation and are just ready for that. Then we have a look at some markets that are at the tipping point, that they could go really one way or another. They've got so far and they're at that kind of tipping point where it's either going to go really well or not so well. Then we've got some that are at base camp. They're just they're kind of really on the cusp. And Basecamp just allows, that's quite an interesting place to be, because in some senses at Basecamp, you've got the foundation and you kind of can leapfrog into the acceleration phase. So those are really interesting places. And then you've got those that are really at the start of the journey. They don't know what they don't know. And I think different countries and different regions are at different stages. I think the UK is quite unique. We've got really high adoption and use of digital health here in the UK. It's really a fascinating place to be in the NHS. We're really good at innovation, but we're kind of not so good at terms of reimbursement. And so it's really difficult. It's kind of, the NHS is kind of the world's largest cottage industry. It's kind of full of hundreds of organizations. There isn't one NHS. So it's difficult to sell into, but you can see real great pockets. When you have a look at places like Europe, France is in the cusp. They're kind of, they're at base camp. They're looking to what others have done, and they're in a really exciting place where they could leapfrog. Germany has done some really great work in terms of having a framework and having an assessment process, and then having central reimbursement. But the middle piece is kind of not so great, in the sense that they've only got 33 products after 2 years, and they haven't really got the distribution done as well as it might. I think they've got about 40,000 prescriptions in the last 2 years, which sounds a lot, but some products do that in a month. And then we got the US, and the US is, I would say, they're at this kind of really exciting phase where it could kind of accelerate out the park and could just be the most amazing kind of place in terms of digital. And we, in some senses, that's kind of great. And we can see that with the FDA and some of the wonderful work that Center for Digital Health is doing. But that needs kind of support. That's kind of supporting software as a medical device. But when we think about software as a medical device, just being about 5 to 10% of the market, how do we help the other 90%? So right. I think there's some really interesting things, which is kind of why we've been working in the US to help kind of accelerate things. And then obviously you've always got the age-old problem of reimbursement. But I think it's a really exciting kind of place to be in the US. There's some really lovely innovation happening right across the sector. And then we've got interesting places like Australia. They're just about to kind of release their digital health framework over the next kind of few weeks. And I could kind of continue around the world. The Nordics is really exciting, actually. The Nordics, if anyone's in HIMSS in Helsinki next week, please kind of get in touch. They're about to kind of launch the Nordic baseline review. There's some really exciting things there. So the whole kind of world is a buzz with kind of digital health. And I think if we brought all of that learning together, there's so much good that can happen.
That's awesome. So thank you for that. I think the audience will really appreciate that, getting that update, because I know that some businesses for one reason or another, decide to circumvent the US market and have more success with their initial launch and commercialization in other countries, and then circle back to the US later. And then some of them, just stay in the US. So it's really very insightful information.
Yeah, I mean, the US is tough, because the US is not one country, it's 50 states, which is the size of Europe. So, no one goes over to kind of break Europe. They'll go over and, so I think, how you kind of grow in the US is the more pertinent question, rather than whether it's a great market to enter. It absolutely is. It's just how you do that is and how you operationalize that is absolutely kind of key. And for any listeners that want to get in contact, we help, some of those standards right across the world, and we're always happy to kind of give advice, and support people. It's really important for us to do so.
So how can folks get a hold of you after the episode?
Yeah, so you can either go to our website, orcahealth.com. So Orca is ORCHA. Some pronounce it Orcha, but Orca stands for the Organization for the Review of Care and Health Apps. So Orca actually stands for something. So orcahealth.com. You can go to our website, or you can email us at hello@orcahealth.com. Very straightforward. Or you can go and find us on LinkedIn, Twitter, etc. You'll find us if you look for Orca.
So one of the questions that I like to end with is this question around legacy. So I firmly believe that all the actions and the investments that we make in our life are forming a legacy, whether we know it or not, whether we're being intentional. And so I think a lot of the work that you're doing is really going to reflect the legacy that you leave behind. So how do you want to be remembered, whether it's in healthcare or whether it's out?
Yeah, I think for me, I want Orca to be remembered as improving lives through technology. That if we've helped and touched every technology choice in healthcare in some way, whether behind the scenes or whatever, I think that's a really lasting legacy, whether that's to help them in terms of their growth, or help them in terms of shining a light on the great work that they're doing, or being able to help get them into the hands of kind of patients. I think if we can improve lives through technology, then that would be a wonderful lasting legacy. And that's kind of why we are a mission-led, values-driven organization.
Sounds like a great cause, and we need it all around the world. Thank you so much for joining me today. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.